To place the aliosphere balloon, the patient should be under general anesthesia and intubated. He will be in left lateral decubitus. The first step is to practice an esophagoduodenal fibroscopy, which enables to eliminate the duodenal gastric esophageal lesions, which would contraindicate the placement of the balloon. In our experience, the presence of a hiatal hernia is not a contraindication for the placement of the balloon, should the reflux disease be treated and stabilized medically. The aliosphere bag system includes one radio-opaque intragastric balloon with double polymer pouches covered with a silicone envelope, the whole in its protective cover, one introduction kit pre-connected to the balloon for the filling of air. First of all, the protective cover and the catheter connected to the balloon are lubricated with a surgical gel. The balloon is then introduced in its totality through the teeth holder, using the index as a guide, in order to allow the passage of the balloon through the esophagus until the stomach, using the graduated catheter. The endoscope is then reintroduced beside, which enables to control the right position of the balloon. The valve must be at about 2 centimeters below the cardia. The dark-colored safety loop is cut with scissors or a scalpel blade. Then the special knitted thread, marked by a small rectangular label, is slightly pulled, allowing the balloon sheath to open. This operation is under endoscopic control, so as to verify that the sheath removal has been totally carried out. Should the removal of the sheath have not been completed, you must absolutely remove completely the whole device and use a new aliosphere bag system. The filling of the balloon with air is carried out using a syringe of 60 cc's, which will be connected to the catheter of injection, which is provided with an anti-reflux valve. Fill slowly the balloon using 15 syringes with 60 cc's of air. Once the balloon is filled, unscrew the stainless cannula of the anti-retur valve and slowly pull while maintaining with the other hand the catheter at the exit of the teeth holder in order to retract the inflating cannula outside the catheter of approximately 5 centimeters, which corresponds to the black mark of the cannula. Then slowly pull the filling catheter. This will allow the release of the balloon at the cardia level. Once the balloon is released in the gastric cavity, check that the inflating cannula does not exceed the distal end of the catheter. Then delicately withdraw the introduction system under endoscopic control. Then check the integrity of the balloon, both in direct vision and retrovision, as well as its good positioning under the cardia. The extraction device, bag extract, is composed of a draining catheter for the air pouch provided with a trocar cannula and a bipolar hooked extracting grasper. You must carry out the extraction procedure of the balloon on a patient with an empty stomach, under general anesthesia and intubated in the left lateral decubitus. First of all, the integrity of the balloon and the absence of gastric lesions are endoscopically checked. Then, using the draining catheter provided with a trocar cannula, the balloon is punctured the opposite side to the valve, and the catheter is introduced inside the balloon until disappearance of the colored marks. Then the air is aspirated through the catheter until the complete draining of the balloon. Once the complete draining of the balloon is realized, using the hooked extraction grasper, the balloon is grabbed at the valve level, then is slowly removed under endoscopic control, while slowly crossing the cardia by the valve in first. Once the cardia entirely crossed, always withdraw under endoscopic control the balloon through the esophagus, then extraction by the mouth. Once the balloon is extracted, the patient should be checked endoscopically again in order to be sure of the absence of esophageal or gastric lesion, which could have been induced by the extraction of the balloon. Radiological image of a radio-opaque balloon, heliosphere, showing its position under the diaphragm. Echographic image of the intragastric balloon, heliosphere.